Good morning and welcome back to Morning Express. It's now 19 minutes after 8 and glad that you're here with us this morning. Today's Wednesday, and on Wednesday we like to take care of your health. Today we would like to tackle a subject that I'm sure would be of interest to many, and just before we continue, I'll let you know that the phone lines are open in case this would be one that you're interested in. I'll give you an opportunity to interact with the doctor who I'm going to introduce shortly. But first, let me let you know what we're talking about. We're talking about hair. And yes, hair is definitely a beauty aspect for some. Others, it's a fashion item. So we view hair differently. But what do you do in cases where it becomes a challenge? Maybe you'd like long hair, but it doesn't grow. Or because of medical reasons, you lose your hair. Or maybe just because of stress. I hear there are people who literally lose their hair because of stress. Well, that's a conversation we're going to be having here. And ladies, I know this is one that you'd love to weigh in and find out how you can get that long, elegant hair. I don't know if I should say this, but give the horses a break. I'll probably get into trouble for that. But anyway, matters hair is what we're going to talk about. And I'll introduce the doctor first, but there's a story I'd like us to run. But joining me to do that is Dr. Dindi Keith, who is a hair transplant surgeon. Good to have you. Good morning, and thank you for joining us.
Good morning.
But before we engage and continue with that conversation, here is a story that our in-house doctor, Dr. Mercy Korir, had done with Dr. Dindi earlier, just to set the pace for our discussion this morning.
Anna, not her real name, had lost all hope when she realized that her hairline was slowly but surely receding. She was losing her good hair.
Before I had very beautiful hair, which was all over. Then I started losing my hairline. I don't know, it's because of the braids.
A step of faith, and almost a year later, she tells me she's happy.
Because it has worked. I have my hairline back. Even the bald is going.
The science of hair, as explained by Dr. Keith Ndindi, a hair surgeon, is a new frontier in Kenya. 3 years and more than 400 hair transplants later, Anna is a living testament to what science and medicine can do to one's looks.
In Japan, for example, it's very popular for ladies to get pubic hair transplant. And it's just for some curious reasons. Yeah. But here in our country, we are only doing mainly beard, eyebrow, and head. So this is the skin surface.
To understand how hair transplants work, we have to get to the basics.
The follicle. And down here, the follicle, there's something that we call the dermal papilla, because this is where all our blood vessels are coming. And keep the skin warm. So when you're doing a hair transplant, this is the part that we are really interested in, because this is the root of the hair. So when you take this and put it elsewhere, it reestablishes this connection with the blood supply at that place. Then the hair starts growing. So the hair that grows out, really, this is dead tissue. The living part of hair is here.
Different scalp and hair conditions warrant a visit to the hair specialists.
Simple things from as much as nutritional deficiencies. A lot of ladies, when they're having issues with probably heavy menses, literally when the iron levels go down, we see the hair beginning to thin out. There are also literal medical conditions, like especially many autoimmune conditions.
Cancer patients undergoing treatment causing hair loss also have a chance at a new look.
Once the medications have been stopped, there are little manipulations you can do on the scalp to help the hair grow much faster.
Common beliefs on how to grow hair exist.
Recently had that you stand on your head for 30 minutes every morning and the hair grows.
With a 90% success rate, Dr. Ndindi explains that the process of hair transplant is simple. It starts with a thorough specialized examination to make a correct diagnosis.
It just allows us to see the scalp in a little bit of greater detail. So this magnifies the scalp many, many times.
One can only donate his or her own hair from a different part of the body or the scalp.
The recipient site, the area where we planted our follicles. So we're just having a look to see how the follicles are doing. compared to the donor side. These are all new hairs that are thickening up. They're the area that was bare, and now we can see nice hair strands that are coming through.
Once a diagnosis is made, the actual hair transplant begins.
One of the most common interests in hair is focused on hair growth and hair care. When one loses hair, it's almost a frustrating and often embarrassing situation for both men and women.
After the transplant is done, one is advised to be gentle with the hair. It is not an instant journey, but one that takes at least 6 months for clear results to be enjoyed.
One of the commonest reasons of hair loss that Dr. Dindi sees is what we call traction alopecia. This is loss of the natural hairline in most women due to braiding and chemical treatment of their hair over a long period of time. Dr. Mercy Korir.
That's our in-house doctor who had prepared that earlier on. And of course, it gives us details of, first of all, how it works and why it works. And let me reintroduce again the doctor we're going to be having that conversation with this morning, and that's Dr. Dindi Keith, a hair transplant surgeon. Now, Daktari, on a lighter note, before we go into the very serious matters, because I can already see I'm in trouble for saying we give the horses a break. I've always wondered, why do ladies from this part of the continent tend to go for Brazilian hair? Is there something special about Brazilian hair?
I think the issue with the African hair, or Afro hair as we like to call it, the tight curls. And many times there's some difficulties or challenges in terms of management. So for a lot of ladies, they feel probably the straighter hair is easier to manage. And there's some obsession for some reason with long hair, where people feel maybe longer is beautiful. So that's why a lot of ladies are going for that Brazilian
look.
Yes.
And long hair. Well, nothing against it, nothing wrong with it, but there you go. But I'm glad there's also, I think there is currently a huge movement regarding natural hair, which is a good thing, which is why this conversation is relevant. But now, let's break it down. First of all, what are some of the causes? And especially, I know for ladies, you mentioned some of them there, but what are the main causes that you'd find possibly cause hair loss?
The commonest thing that we see in our setup amongst the ladies is what Dr. Mercy Korir alluded to, traction alopecia, literally harassing of the hair follicles. Because there are ladies who braid week to week, they don't give the hair any break. The braids are too tight, they're too heavy. Even children, some children are barely 3-4 years old, and you see very heavy braids on them. So they start losing hair when they're that young. By the time they're adults, they're in their teens, then the situation is really bad. So traction alopecia is the commonest cause of hair loss.
And when you talk about traction alopecia, maybe break it down to me who does not know what that means. What exactly is it? Is it just, what is it?
When we talk about hair loss, when you say alopecia, we just mean hair loss that is abnormal. Because there's some hair that we shed every day, about 100 strands or so. That is normal. That is normal. But once you start shedding more than that, then that is abnormal. So we call that alopecia.
Okay.
So when you say alopecia, really just a general term that it talks about that abnormal hair loss. But when it comes now to traction alopecia, we say it's that hair loss that is caused by literally pulling of the hair. Yes, so it's very common along the hairline because that is where, the ladies say to really look neat. You want it tight and neat. And that stays for a longer period than maybe if they do it a little loose. So many ladies want that tight, neat look, but it comes now at a cost.
At a cost.
Yes.
Okay, now I'm sure most of the hairdos and what we do with our hair in terms of chemicals and all that braiding and all that is more to do with cosmetics and maybe convenience as well. For, you don't want to go to the salon every single day. But what's the best way of maintaining hair in your opinion? If one really just wanted to maintain good hair, regardless of how inconvenient and what it would cost, what's the best way? What would you advise as the best way?
Let me start first by saying that whether natural or relaxed, really, one wants their hair. The thing to have is freedom. If you want to have it relaxed or natural, you can go either way. It's good to have that freedom. However, there are unique ways of managing each. When you come to relaxed hair, for example, because the chemical structure of hair has been messed up with, then there are things that you must do to maintain moisture, to deal with the strength of the hair strands. That happens because the hair has been relaxed. But generally speaking, there are two main issues that are important when it comes to hair. Number one is moisture, moisturizing of the scalp, which is a very important, even men need to do it. Many times men feel that so long as you throw some soap on the scalp, rinse it off, that
You're
is
good
it.
to go.
You're good to go.
Yeah.
Yeah. But there's damage that happens on both the scalp and the hair because of lack of moisture. So moisture is critically important. The other issue is shampooing. What we tend to see that a lot of people use normal soap to wash the hair. And that normal soap is very harsh. The alkaline in the normal soap is very harsh for the hair. So you need shampooing, and this should be done at most maybe twice in a
we're
week.
talking about both for men and women.
Yes, both for men and women. And if you do, men especially like to wash their hair every day.
Yes.
They think that is normal. Then they start having trouble with dandruff because the skin now becomes very dry. You're not allowing the natural oils that are produced by the scalp to moisturize the scalp nicely. So that frequent washing is one of the reasons why we tend to get dandruff in men. So generally speaking, shampooing of the hair at least twice in a week and moisturizing, basically. Then now, if you've done something with the hair, maybe colored the hair, dyed the hair, or relaxed the hair, then there are other specific issues that come to play.
Okay, now, and I ask this for the men, two things. One, is there anything wrong with washing your scalp every day? I mean, I'm a victim of that. I wash my head every day. Is there anything wrong with that?
Yes. When you wash your hair every day, you are not allowing this. God, in his wisdom, allowed the scalp to have certain glands that produce oil that is very nice for the scalp. So it percolates along the hair strands, and it takes about 2-3 days to get nicely to the surface. So when you keep washing the hair every day, the scalp becomes very dry and then starts flaking off. So the dead skin cells now is what we like to call or to see as dandruff. So at most, twice in a week, and then moisturize the scalp.
Okay.
Yes.
You've talked about moisturizing the scalp. Again, I ask for the benefit of us men who may not know what that is. How do you moisturize your scalp? Is it just pouring water on it?
When you talk about moisturizing, there are products that are out there that are well labeled as moisturizers. So those products are the ones that we like to use. I don't want to mention any trade names, but just generally speaking, the moisturizers that you use, people like to call them loosely mafuta ya nywele. Yeah? But you need at least something that just to moisturize the scalp, keep it nice. Then depending now, if you've maybe put dreadlocks or you've relaxed the hair, there are a few other things now that will come to the specific care of that hair. Hair that has been processed, for example, lacks moisture. Hair that has been processed, you have to see how to manage. And those are the two issues there, moisture and protein. Protein gives it strength, and moisture, because the cuticles now will start leaking a lot of I think I'll not go into the science of the structure of hair, but suffice it to say, when the cuticles are open, there is a lot of moisture that is lost, so that needs to be restored.
Okay.
So moisturizing and protein treatments are important for hair that is now been relaxed.
All right, before we move now to the hair transplant bit, which is what we're coming to, are there specific products that one maybe should, and I'm not talking about trade names, I'm talking about specific, for instance, if it's shampoo, how do I know a good shampoo? Because in this day and age, we have very many commercial people out there who label a shampoo. Is there a way of telling that this is a good shampoo for me or a moisturizer?
There are two ways of knowing. Yeah? One is just the vigilance. And when you're talking about vigilance, when you're buying the shampoo, there are certain things that you're looking at. One is the pH, and it's always labeled. It's a condition, they must label. So the pH, the more alkaline it is, the worse for your hair. And alkaline, if you remember the chemistry, those things above 7, you know, talking 8, 9, 10, 14. Yes. So you want something that is more in the acidic, because the normal range for hair is about 4 to 4.5. So the closer it is to that, the better. Then if the shampoo is sulfate-free, you know, in terms of the residue that it leaves on hair. So you want a shampoo that ideally should be sulfate-free. The other thing that I like to advise my clients, how does the shampoo leave the hair feeling? So literally, when you use the shampoo, does the hair feel brittle, dry after you have used it? So in that case, you know, this is not a good product. The hair should feel supple, clean, but not excessively dry. So sometimes it literally try and error. You find something that now works for you. so that the hair feels very good after using the shampoo.
Okay. All right. Now, the other thing is, although I don't see that commonly, is rings. When you have rings on your head, what first of all causes that, and does that affect your hair, or is that just a skin issue?
There are two things there. There are patches of hair loss that can appear, what people like to commonly call ringworms. But there are patches of hair loss that could have nothing to do with an infection. There's a condition we call alopecia areata, which is an autoimmune condition in the body, and it could manifest as discrete lesions or rings on the scalp. But there are other infectious conditions that can also manifest in similar manner. So what they call ringworms or fungal infections can have the same presentation. But when you come to us and we have a look, there's a special way in which you can be able to tell, no, this one is more of an autoimmune condition, or this is an infectious condition.
Okay.
Then the management now will depend on which of those two it is.
All right. Let's now look at the hair transplant. And how does that take place? And how do you diagnose that this is somebody who requires hair transplant? If somebody possibly wanted more volume of hair, is that somebody who qualifies, or is it more of a medical issue?
There are about 4 main causes or conditions that are very good candidates for hair transplant. One is something that we call male pattern baldness. You know, there are people just genetically, they lose hair. In my family, for example, everybody has lost hair. So you can see it's a genetic pattern. That male pattern baldness, there are things that we can do to restore the hair that has been lost. Number 2, in the ladies, there's something we call female pattern hair loss. And that is also very nice, where we get hair follicles from certain parts of the scalp that are not losing hair, and we place them on the parts that are losing hair. The other one is, of course, traction alopecia, where if after somebody has lost the hairline, we can be able to get hair from the back and we restore that hairline. And then lastly, for certain conditions, for example, somebody has suffered burns, somebody has had a surgical scar, for example, that these people who get head injury and there's this big scar that has been left because of what the doctors did, there's a way you can camouflage that scar so that it's more cosmetically acceptable. So in those conditions, then hair transplant would really be a good way to handle those. Sometimes we even do for people who have lost eyebrows, especially ladies, maybe excessive threading. Slowly the eyebrow starts disappearing until it's like a tiny line. So there's something, again, you can do to just give that volume back.
Okay.
Yes.
Now, for men with receding hairlines, and sometimes this is genetic, it's something which is inherited, where you have literally a bald, we used to call it airport, I don't know. Is there intervention that can be sought for that? Or would you just rather maybe settle for a toupee?
Mambo ya Donald Trump tuache. But yeah, for men who are losing hair, actually in the world today, more than 70% of the hair transplants being done are for men who are losing hair because of genetic hair loss. So it is the main reason worldwide why people are doing transplants. So in our setting, yes, it is being done. And once you've lost the hair, you don't have to know a Jordan, as we call it. Yeah, there are at least options. That hair can be restored via surgery. There are also other men who lose hair due to other conditions. There are other medical conditions, you know, like their thyroid disorders and so on. Or sometimes people have undergone treatment like chemotherapy and they're losing hair. Then there's something that can be done about that. In the ladies, it's mainly traction alopecia. Once somebody has lost hair, that thing that we call a hair follicle is really the root of the hair. So once that has been pulled out or destroyed, there's nothing you can do unless you're replacing the root. So sometimes ladies apply very good substances. It's like putting fertilizer where there is no seed. So once that follicle is gone, unless it is replaced, you cannot have growth at that place again.
Is there a way of knowing when the follicle is removed, apart from now coming to you? Is there a way one can tell that this is actually, because you're talking about, you know, applying fertilizer where there's nothing, one may think there's still something. Is there a way of knowing?
It's very difficult to know unless you come in for an examination. But an easy way of just guessing that probably there's trouble is when the hair has not been growing at that spot for a period of more than a year. So you've tried doing stuff and a year has gone by and the hair is not growing, because hair grows in cycles. There's 3 cycles: anagen, catagen, telogen. So once you go through those cycles and nothing is happening, most probably that follicle is damaged completely.
Okay. In terms of time frames, especially for the receding hairline, both male and female, we have ladies who also lose the initial hairline. Is there a time frame in which it can be replaced, after which it becomes too late? Or is it done whenever?
Yeah, not really. Actually, we do have clients who are in their 60s, 70s, and they've not had hair for 20, 30 years. Yeah, so long as there is no condition that a contraindication, because there are those conditions on the scalp that we cannot do the transplant. But if that is normal, then really at any age, or even if you stayed with the hair loss for a long period of time, a transplant can still work.
Okay.
But
what are those conditions?
But there's some specific, and we like to call this group, when we talk about hair loss or alopecias, we classify into 2 general big groups. There's something we call scarring alopecias and the non-scarring alopecias. So the scarring alopecias are the difficult type. And these are the conditions where many times we will not do a hair transplant. The reason being, these are autoimmune conditions. So the body is fighting against itself. You get the body's white cells fighting the hair follicle. So even if you take the hair follicle from somewhere else, na unaleta pale mbele, the same process will start again. Then you lose those hairs. So we always like to preclude those conditions. Then know, okay, this scalp is good to go, so we can do a hair transplant.
Okay. And with those conditions, there is no intervention?
It's just that the journey is longer. Okay. Yeah. So like in autoimmune conditions, it's good to note that this is something that somebody has intrinsically, so it can never be treated completely. There are just ways in which we can handle or manage the condition so that it's not in its active phase. So there are small manipulations we do on the scalp to ensure it is not in its active phase. We can do the transplant, but knowing that we have to be more vigilant in the future. If we notice there's something beginning to happen on the scalp, somebody comes again for some treatment. So there are some little things we can do. The journey is longer, then it's a lifetime of vigilance.
Okay.
Yes.
Now, let's talk about the procedure. If somebody now wanted to have that hair transplant done, what's the procedure? Where do you start?
Starts at diagnosis. So somebody needs to come so that we say, hey, this is male pattern baldness. Hii umevuta kwa sababu ya zile braids. Just really knowing what exactly was the cause. Once you've established that this is something that can be handled via hair transplant, then somebody is taken through the process. And the process really takes a whole day, because each single follicle is being harvested at a time. So it's done under local anesthesia, meaning someone is awake, they know what is going on. Maybe they could be doing something on the computer or on the phone as we are doing our work. So we numb the scalp using local anesthesia. Then the follicles are picked with a special machine, one at a time, placed in a special storage medium, and then they are transplanted. That whole process takes about 5-6 hours, depending on the area that is being covered. Immediately after the transplant, there are a few little things that are given as aftercare. For example, somebody is not allowed to wash the scalp for about 14 days. You're not allowed to go maybe for a swim or do very aggressive aerobics, just because we are trying to allow the follicles to really take root. The period after that, in about 3-4 months, that is the time when somebody notices lots of the hairs beginning to grow.
To grow?
Yes.
Okay. So now, once you've come and you've done the assessment, basically, what is the next thing that somebody needs to do now in terms of preparation for the transplant to be done?
There are only 2 things that are done in prep. One, there's a normal blood work that we do, just like any other surgery that somebody is going for, just to know that, the blood levels are all right, there's no active infection going on. Then after that, we give a certain booklet that just explains the things that somebody is to expect, what are the post-op complications, if there are any that could occur, how do you handle the pain, just generally knowing. Then there's a consent form that somebody has to sign, because yes, this is a surgical procedure, and we go ahead and do the procedure. Okay. Then now give the aftercare. And usually we like to tell our clients at 6 months, that is the time to expect about 50% of the results. For the hair really to be back to like the rest of the hair, it takes about a whole year. A whole year? Yes.
Wow. And what's the success rate, generally speaking, of the surgery?
The success rate is about 90%. In about 10% of people, the hair will not grow at the rate that we expect. Yeah, so it might delay. So instead of a year, it can extend up to even a year and a half.
Okay.
Now, the people that the hair does not grow completely would come to about 3 or 4%, where for some reason, which we cannot explain, everything is normal, done what you need to be done, but somehow the hair doesn't grow. And in medicine, there are things that happen like those where we really cannot explain why somebody is not responding to the treatment that you're giving. Sure.
But 90% is pretty high. That's not a bad success rate given the kind of surgery that one is going through. But then the other thing would be now, once within that success rate of 90%, are you saying that your hair goes back to normal, to what it was originally? Or is it certain segments of your hair, those that have been implanted, maybe should not be expected to be like the rest of the hair, which is natural?
It's good to note, you know, when we use the word transplant, sometimes people imagine you're getting tissue from somebody else. The hair that we transplant is actually from the same person. So they just one part
from somebody else to you.
Yes, the body has a way of saying, hey, you see your
Yes, I don't know that person.
Yes, so you can only get hair from the same individual. So you can get hair usually from the back of the scalp. God, for some reason, gave us our best hair, huku nyuma. So you can get hair from the back of the scalp. For men, we even get hair from the beards or even chest hair, and we take this hair on the scalp. So because it's your own hair, you can handle it like the rest of the hair. If somebody wants to do color, if somebody wants to relax the hair, if they want to braid it, anything that they could do with the rest of the hair, they still do with this hair. The way in which we take the hair, we ensure that at the donor area, that is the area where you're getting the follicles from, there is no scar left. So the rest of the hair grows so that somebody looking at you visually would not be able to tell something happened. Unless now we are coming to magnify the area using our tools and implements, you can tell, hey, there's
something
here.
here.
Yeah, but on the visual look, everything looks quite normal. And that hair is normal hair, it's washed. Everything that you do with the hair, you can do with that.
All right, now the opposite, and maybe there are those who possibly, for instance, I'll use a beard as an example, a safe example. There are those who possibly would want to maybe have hair, instead of going to shave every time. Is it possible to have the opposite done, where now you remove the beard permanently?
Yes, and let me talk about two aspects. One, there are the hairs that grow that are abnormal. For example, ladies developing a beard,
right?
Yeah, so it can be associated with a number of medical conditions. Those ones can be removed, and using the implements that we use for harvesting the follicles, you can remove those hairs. And because you're removing it from the root, it cannot regrow. However, for people having lots of beard hair, it would not be practical to remove all of them.
Every one of them.
Yes. So what we do, there is a laser treatment, you know, although somebody now has to go for a number of courses of laser treatment. And we don't do it ourselves, but there are colleagues here in the city of Nairobi who do it. So you go have laser, about 7-8 sessions, and remove that hair permanently.
Okay.
That's possible.
Possible side effects, maybe once you've done the transplant?
The worst, of course, is the hair not growing. You know, but on day one after the surgery, there's always a lot of discomfort just because of being in a certain position for long, so some headache. The other things that could happen is possibility of an infection. That's why we always give prophylactic antibiotics just to prevent any infection. But other than that, really, this is a procedure. You're getting your own tissue so the body doesn't reject. Pretty safe to do.
Does it come with any form of medication that is required? Because one maybe might want to have the transplant, but maybe not go through any kind of medication for a period of time.
Okay. The medications we give are of two types. One, this is the antibiotic, just to prevent any infection. Then the other is a painkiller. Yeah, just to ensure you're comfortable, especially the first 3 days after the procedure. And that is it. There are no any other medications that are given. There are some transplant centers in the world that give men with male pattern baldness a drug that we call finasteride that just acts against the hormone that really causes the male pattern baldness. Yes, but we've not seen any added advantage of using it in our setup. So those two, antibiotics and painkiller, and somebody is good to go.
Okay. Now, for medical cases, for instance, those who possibly have lost hair because of cancer, is their case the same as one who is transplanting just normally, or does it bring in complications? Because obviously their loss of hair is not a natural process.
True.
Yeah.
The issue with cancer, many times it's not the cancer itself that is causing the hair loss.
Correct.
Yeah. So most of the time it's because of the chemotherapy that is being given. Its general effect on cell metabolism. So you're having cells that are not multiplying, and hair is one of the fastest multiplying tissues in the body. The good thing is that after chemotherapy, that hair then gets an opportunity to start growing. But what we do at our center, at Hair Hub Trichology Center, there's some medications or treatments that you can do on the scalp so that you stimulate the rate of growth. So that if somebody was to recover, for example, over 6-7 months, then they can recover that hair much faster. In 2-3 months, you get the hair back. So after the treatment is done, you cannot start the treatment until somebody is done with the cancer treatment. After that, then there are things you can do just to hasten the process.
Okay. Now, there are certain myths also that surround hair loss. And one of those, I don't know if it's myth or it's fact, you probably, I think, mentioned it in the story, is stress. But first of all, is it myth or fact?
It's fact.
It's fact. You can actually lose hair because of stress.
Yes, yes.
All right. Now, at the point where you lose hair because of stress, when your stress levels come down, does the hair automatically grow back, or do you still need the implant?
Two things. There are times when you lose the hair and the hair will grow back. However, stress can trigger certain conditions that somebody had. For example, alopecia areata is a condition that somebody might be having and it's not yet been manifested. When you get stressed, it triggers it off. So you start having those discrete lesions of hair loss. So if the hair loss was diffuse, what we like to call telogen effluvium, stress can make most of the hairs go on the resting phase instead of the growth phase. So when the levels are down, then things can get back to normal. But once it has triggered off another condition, then that condition must be treated as an independent entity.
All right, I have a question here from Juliet, who says, I had very long hair until I was 17. Then suddenly it's become very difficult to maintain long hair. Please advise.
When it comes to long hair, the length of hair is actually genetically determined. So that period that I'm calling anagen ranges from 2 years to 7 years. So that growth phase, if yours is of the 7-year area, then the longer the hair will be. If it is of the 2-year area, then the shorter the hair will be, if you're managing the hair properly and everything else. But beyond the genetics, the management of the hair can really determine how long the hair grows. Yeah, so that many ladies, for example, if you've relaxed your hair and you're allowing too much growth on it, then the area between the relaxed hair and the growth is an area of weakness. So hair tends to start breaking at that point. There are other people, because of the issue you're talking about, no moisturizing of the hair, the treatments that they're meant to be doing with the relaxed hair, they're not doing, so the hair starts breaking off. There are other things also, like many ladies after childbirth, they notice that they're really losing hair. There are hormonal imbalances that check in, and somebody can really start losing hair. Issues to do with the thyroid gland again. So many times a client like that would need to have a sit down, find out how old are they, are there any medical conditions that are going on, and how are they managing the hair. Then we thin down and say, hey, you are not treating your hair nicely, probably you're not moisturizing it well. This is what we need to do, and you get your hair back.
All right, Kiprop Langat also has a question, and this is to do with affordability. How affordable is this procedure?
The cost of the hair transplant is based on, I like the word you used, airport. Yeah? How much
How
of the
big
airport
the airport is. Whether it's Wilson or Maijeke.
Yes. So if it is Wilson, then the figures are less. But ballpark figures, we charge about 130 follicles for 130 shillings for each of the follicles that is being planted. So if it's 500, somebody can do the maths. If it's 1,000, that is how we charge for the procedures.
But of course, one would not be able to calculate and know how many follicles are required.
Yes.
You would have to give that
analysis. But generally speaking, you're talking of usually about 1,000 follicles for an average patch of hair loss.
Okay.
Yes.
And once that payment of 130, is that including now reviews and all that, or is that just for the transplant?
That is for the transplant. The only other charges that people pay, of course, is a consultation fee at Hair Hub, and then the rest, the reviews until the hair starts growing at about 6 months, those reviews are free.
Okay.
Yes.
All right. Thank you very much, Dr. Dindi Keith,
Thank you
for that, I'm sure, invaluable advice regarding our hair.
Thank you very much.
All right.